What's going on, guys? Dr. Andrew Fix back for another episode here on the Code. And we're doing a little walk and talk today on a little stroll through the neighborhood, catching some of this awesome weather, great sunshine that we're having in the middle of November here in Colorado. And what I want to talk to you guys about today is what to do when it comes to exercising, when it comes to training, right? Specifically, I'm talking about resistance training, but we can adapt this to other things too. When you're not feeling your best, because this was the example that I had this morning. Yesterday, my wife and I had a little bit of a potential false alarm family emergency happen. So I ended up leaving work early, got home, and didn't end up going back in, didn't end up getting the workout in that I had planned for that particular day, which in my case was going to be deadlifting, some other circuit things, a cardio related finisher. Anyways, so what I decided to do was I'm going to make that workout up today. And we went and did that this morning, went into our office in Highlands Ranch at Physio Room, used the awesome set of weights and equipment that we have there, did the deadlift workout. Now, in this particular workout, from a deadlift perspective, we were supposed to do 5 sets of 5, progressively building up the weight, doing a pretty challenging sets of 5. And, my goal was to do that final set of 5, probably somewhere in the mid to high 300s. I mean, I would say my strength is not feeling quite what it has in the past after, just having a baby 2 months ago, workouts and sleep not being as consistent as they typically are. So anyways, last week, I think I was in the low 300s. I was hoping to get up 20, 30 pounds more or so this particular week, because those are weights that I've used before, right? Those are weights that I'm familiar with, weights that I know I can do for those reps, but it's been a while. And anyways, yesterday, particularly in the evening, ended up holding our daughter for quite a while. We're in the baby carrier, walking around the house, rocking her, holding her, trying to get her to settle down. And, for anyone that has ever carried anything for a while, particularly children, if you're a parent, you know that holding kids for a period of time, man, it starts to make your back tight, your mid back, your lower back. If you're looking down at them, your neck. So anyways, I got to the clinic, to the gym this morning to start warming up for this deadlift workout. And I just wasn't feeling my best, right? I knew going into it, I was like, man, my lower back feels tight. I want to lift, but I don't have a belt with me for these higher ranges anyways, higher percentages, and I better just be smart about this. What would I tell a client to do? And sometimes that's the hardest advice for us to take as providers, as coaches, as trainers, is our own advice that we would tell a client, because we are trying to walk the walk. We're trying to do the things and set a good example. So anyways, I do a couple warm-up sets, and I just decided, yeah, my back is feeling a little tight. I'm not going to avoid the movement, but I'm going to modify how I'm implementing it, how I'm performing the workout. And in this case, what I modified was the load that I was using, right? I modified what weight selection I was choosing for which sets. I started my range a little lighter, or I started my sets a little lighter than what I had originally planned to do. Gradually built up throughout the sets, but did not go as high as I was hoping to do going into the workout, or prior to waking up this morning feeling that my lower back was stiff. Additionally, I made a trade-off in the workout. One of the movements that we were supposed to do after the deadlifts in a little circuit format was a single leg deadlift with 2 dumbbells, another hinge-based movement. What I decided to do instead today was a suitcase carry with a kettlebell. Single carry, carried that around the clinic, along with the other movements of the circuit that I did as normally prescribed. What I'm hoping to do, I'm out on this walk now, my back is starting to feel a little looser. As a matter of fact, it does feel looser after doing the workout, after going around and getting the movement in. But what I'm hoping to do tomorrow is make up those single leg deadlifts, because I want to do the movements that I was prescribed to do for this week. I just wasn't able to do them on the days that they were prescribed. So I'm hoping to make those up tomorrow, do them with the weights that I have there in my garage. Anyways, my message to you guys, it doesn't matter if we're talking about lifting, if we're talking about yoga, we're talking about running, cycling, you name it. If you've got a workout on the calendar, first of all, I like to use the terms training sessions, right? If you have a training session, because that means you're actually like following some sort of prescribed plan, which I think is so important. If you're just haphazardly doing random workouts at random times on random days of the week, you're likely going to get random results, right? You're probably not going to get meaningful, consistent, measurable results if you're not following some sort of consistent programming. So there's a plug for when it comes to programming. Anyways, we want to follow the plan as best as we can, but if you wake up or you go to start your training session that day and it's not feeling, your body's not feeling how you were hoping it to feel, your knees feeling achy, your back is feeling stiff, your Achilles is talking to you, it's a little hot, you need to modify things, right? What you can do is you can start to warm up, start to go through the movement preparation and take an assessment of how your body's feeling. If it seems to be responding well and that achy thing is no longer bothering you as much, I would encourage you to try to perform your workout as it's prescribed. But then if that thing starts to bother you, don't be afraid to modify, because the most important lever we can pull when it comes to making progress is consistency. It's not pushing the intensity on one particular day. It's not having to crush and having to complete this one workout. It's being able to show back up for the next training session, right? So if something's bothering you, don't skip it, modify, listen to what your body's telling you to do and adjust accordingly. Like, what movements can you do if this is a weightlifting or some sort of mobility practice? What things can you do that don't continue to aggravate the issue that you're dealing with? Then do those, right? I would encourage you to do those things. Don't do nothing, right? In traditional wisdom, society, sometimes physicians, they tell us if something hurts, then just avoid that. And that's not what I'm suggesting you do. That's not going to help you continue to improve and fix the problem that's going on. We want to keep training, keep blood flow going throughout our body, continue to move the needle forward from a fitness perspective, because overall health and fitness is going to be beneficial for everybody, right? So doing something is always better than doing nothing. Now, if someone were to come into our office, we think they're dealing with a significant injury, a stress fracture or something like that. Yeah, we're gonna tell them to stop doing that particular movement, say running, for example, or weight bearing through that leg. We're gonna have them do something else, right? We might send them for imaging. But that's not what I'm talking about in this scenario. I'm talking about those common things that you probably know, and know what it feels like when you wake up with that stiff back, your shoulder's a little achy after bench pressing yesterday, your knee is sore after yesterday's run, something like that. Listen to your body, modify it, don't avoid it, like I did in my workout this morning, and live to train another day. All right, you guys, we're gonna wrap this episode up. I hope you got what I'm trying to give you in this message today. I hope your next training session, whatever it is, goes really well. It's a little windy. I hope this isn't too loud as we close out this podcast. If you've never listened to us before, you haven't heard me say this, but if you have, now's the time to go leave a review, right? If you enjoyed this episode, if you found something valuable, or if you think there's somebody that could hear this and benefit from it, please send it to them. But scroll through the review section, drop a 5-star review on there, help us get this podcast out to more and more people. We'll catch you guys on the next episode of The Code. See you later.